Okay, so this is Piglet. He is going to be our example for the oral exam today. We're gonna try to just keep him as calm as possible. That's why there's only one handler. I'm gonna offer him a treat, but he's a little uncomfortable, so he might not be interested in that at the moment. So we'll see if he wants that. So for the oral exam, it's just an intraoral exam. We'll look at his lips, his oral mucosa, his dentition, going over periodontal stuff. And then lastly, we'll take a look at his oral cavity. So I'm just gonna start by looking at his buccal cavity and his lips, check out his gingiva, make sure he has all 30 of his permanent adult teeth, normal occlusion, check for foreign bodies, stuff like that. So we will just start with keeping one hand on him. Buccal surfaces look good, teeth look good through here. All normal occlusion in the front as well. Checked both sides. Looks like he was just snacking on something. There's a little food in there. But he does have all 30 of his adult teeth. A little bit of extrinsic staining, no significant wear or enamel loss. I didn't see any fractures at the edges, no gingivitis, so no inflammation of the gingiva. The plaque doesn't appear to be visible to the naked eye, so I would rate him about a P1 on the scale, and no real visible calculus, so again, probably a 1 on the calculus scale. So now we're just going to check out his tongue and his buccal cavities. I did make sure his gums were moist and pink. I should do a quick check of his capillary refill time. And that was less than 2 seconds, so that's good. His gingiva is nice and pink, but a little bit of dark spotting just because of his pigmentation, but that is perfectly normal. So now I have looked at all of the outer stuff, and we'll do the little bit more intrusive stuff now, just to get a look in the back of his mouth. His tongue looks good, nice and normal. Roof of his mouth looks really good, so everything inside looks good. Again, not seeing any big issues with his teeth. And the last thing we're gonna do is try to look towards the back of his throat. And then again, just try to stick a finger underneath his tongue to get a look underneath there. Make sure there's nothing abnormal going on. Looks good back there. Everything in his throat looks good. And just gonna, moved his tongue. Nothing weird underneath his tongue. So that's it. We're gonna let Piglet go.